The Africa Centre for Disease Control and Prevention says it has identified countries on the continent that it considers highly vulnerable to the spread of the coronavirus from China. Mostly these are countries with frequent flights there. Dr. John Nkeng-ason, the director of the Africa CDC, says they are working closely with vulnerable countries to ensure that they set up a high standard of prevention. CGTN's Coletta Wanjohi reports now from Addis Ababa.
Ethiopia, Egypt and Morocco are some of the countries that the Africa Centre for Diseases Control says have to put more effort to prevent the spread of coronavirus into their territories.
These countries just need to put extra resources to screen, to enable them do more screening at the airport. Say, for example, if you get 1,000 passengers a day at the airport, say in Addis Ababa, you require much more resources to screen the 1,000 passengers coming from China than an airport that receives only a few passengers from China. So that is the implication on the burden on the resources that are required.
The government set up screening at the Pole International Airport in Addis Ababa for passengers on 23rd January. Its national carrier, Ethiopian Airlines, has at least 36 flights to China weekly. It has yet to pronounce itself on the impact the outbreak of the coronavirus has had on its business. The Africa Centre for Diseases Control says the biggest challenge is that the coronavirus has no treatment yet.
Which means people have to wash their hands always. Secondly, when you cough, you have to cover your mouth. Thirdly, that you have to exercise what you call social distancing, which means if somebody feels ill, you isolate yourself. And fourthly, that organizations have to begin to be liberal with the policies to allow people to work from home if they feel like they call in and they report that they are sick.
The African Union will do its first training workshop on the coronavirus in Dakar, Senegal next week, with representatives from 15 African countries being trained on how to diagnose and detect the virus rapidly. Coletta, Wanjohi, CGTN, Addis Ababa, Ethiopia.